His book is #1 on the Amazon medical book list. So congratulations. Thank you so much.
I think I need that. Thank you, Dr. Ron and Donna and everybody here in Wichita. It's fantastic to be back. This is my last stop on this book tour. I do have other dates that we're going to do things, but the tour is over. We started June 20th, and I'm bloody exhausted, ready to go home, go to bed. And anyway, I appreciate the opportunity to be back in my hometown to close out this book tour. This is where the book tour started. It's in Panama, and this is with Mel Gibson and Dan Bilzerian. I don't know if there's anybody young enough in here to know who Dan Bilzerian is, but he's a hero to young people. Anyway, these guys are real good friends and fans, and they were kind enough to come down for the launch of the book. And anyway, so to illustrate the power of umbilical cord stem cells which are going to be thrown away in the trash. These are not controversial. They're not embryonic. Sucking on mommy's breast, hopefully. And this is what's delivered afterwards, and that's what we take. That's our source of stem cells. And so Mel called me up about 7 years ago and actually left me a voicemail and telling me he wanted to get his dad treated, that his dad had a bad hip, and that's why he wanted to be treated. And when I called him up on further inspection, his dad also had kidney failure and heart failure, and he was 92 years old. And he said, but he's a tough old bird. He's in perfect health. And so very carefully we talked with his doctor at Mayo Clinic and my medical director. We talked to the doctor and we talked to Mel. His father basically was not even speaking at that time. But his big problem was he couldn't even get out of a wheelchair because of his hip pain, and he'd had one hip replaced a couple years before, but he was so unhealthy he couldn't get the other hip replaced. So he was in chronic pain, and Mel thought he was just going to die because of non-movement, which is a real thing. So anyway, ultimately we accepted him for treatment, and we gave him a shot of umbilical cord cells that we manufacture there in Panama in his hip, and gave him several IVs as well. 3 weeks later, he was walking, and 3 months later, he went back to his very skeptical Mayo Clinic guy who came with him, and he was out of kidney failure and out of heart failure. And he just celebrated his 99th birthday last month. So that's the power of these cells. So it's not me, we're just good gardeners, right? It's a very good product that God's given us, but it's not me, it's nothing that we invented, it's already genetically there, right? It's given to us. So the only thing that I can say that I do really well is I grow cells really well. And I can pick winners really well in the cellular world. So that's basically all I do. But the rest of this stuff is not of my invention. So the most exciting thing on my book tour was going to Iceland, which I've never been there. And this is the Silfra. It's basically the tectonic plates are separating. The North American plate, the American plate, and the Eurasian plate are separating there. And one of my goals was to go scuba diving there. I used to be a commercial diver. I got injured. It's all in the book. But anyway, I got injured. Essentially, I had 2 spinal cord injuries from that. And my lifelong dream was go here and dive in this place, which has the cleanest water on the planet. There's not a lot that grows in it. There's not a lot of life or anything, but this water's coming right out of a glacier, and it's 35 degrees. So you need to be suited up, and all that gear on me weighs 92 pounds. So I always wanted to get healthy enough that I could go there and do this. So that was my highlight of my trip. And and I'm a shameless promoter, so I did that one too. So just a word about my father, who founded this place, and this was his life. He gave us so many opportunities, and he's the reason that I'm the guy I am. So the RECNAC project was It was supposed to be 10 years, it wound up a little bit longer, and but one of the things we learned there that was demonstrated here in Wichita, never been demonstrated before, was that you could achieve blood levels, and we have a lot of vitamin C people in here, we could achieve blood levels in humans, not only humans, but in cancer patients, of vitamin C that were high enough to kill tumor cells. So that was done right here. So I just want to give a toast to my father, Hugh Riordan. Charlie. Meg. So as I said, I think I'm pretty good at one thing, and that's growing cells. And at one point, we had 60 different tumor cell lines here. And we were testing hosts. The idea was to test things that were clinically applicable. That's what RecNec was all about. Because the funders didn't want us to just take the money, goes siphoned away, and we're going to go, do whatever with it. They wanted the things that could be clinically applicable. So the big obvious one early on was vitamin C, because it had this. Other people showed that it was preferentially toxic. Other people showed that cancer patients who got intravenous vitamin C lived longer and did better, but nobody showed why or how, and that's what we did here. But the other thing was that everything we had to do had to be translatable. So it couldn't be something 30 years down the road. Bob Page, who funded most of the Page family, funded most of this research, didn't really care what was going to happen. They didn't want us sitting in the lab for 20 years. So they gave us 10 years and a certain number of dollars and said, that's it. And it was a fantastic environment to look at all the literature. I was showing my friend Tracy here the lab and where I used to work, and we had 6,000. Before we did one thing in the lab, we read 6,000 articles on cancer to see why, before you start, why, because you get all busy, right? So we didn't, the great place about my dad in this place was, the great thing was that we didn't have to get busy. We just had to find some answers. So, you know what I mean? This is just, anyway, so we read all these papers and cataloged them and indexed them. Now it's, it's all there on Google. I wish Google was around then. We could have rocked and rolled. But anyway, we figured out the vitamin C deal. We filed patents on that. We never enforced them to allow everybody to treat their patients. But one of the things that stood out was therapeutic cancer vaccines using dendritic cells. And I'm not going to bore you with the details. Long story short, these cells can elicit a major immune response, because frankly, if you have clinical, a solid tumor, and it means that your immune system is being shut down, at least to a certain extent, and your immune system is not recognizing getting rid of it. So these are one of the cells in the body that present, basically, they tell the rest of your immune system, hey, this is a problem. So these cells are a way to make therapeutic cancer vaccines. So we started with that, and in order to make better vaccines, these cells start with stem cells. We have to, they're the net progeny of stem cells. So you need to start with stem cells and grow them. So my first patent in the stem cell world was on taking these stem cells and taking 1 million of them and turning them into 1 billion, so I can make a bigger, better, Betty bought some butter, but she said it's butter, better than that. A better vaccine, basically. So that was my first patent, and that became the premise for Metastem, the Metastem #1, which was a publicly traded company that we wound up selling a couple years ago. So Xiaolong, Ming, and I worked together, and a lot of other people, but we worked together, and Paul Taylor included, who's in the room, or not in the room. Hey, Paul, he's over in the sound room listening. Anyway, so one of the things we discovered was the menstrual stem cell, and that's pretty sexy, right? But anyway, it's a mesenchymal stem cell from menstrual blood, and I want to recognize there's a patient here, a person here, Ryan Benton. So Ryan, I'm going to tell you a story, and then you guys can applaud. But I want to tell the story first. So Ryan's here. His mom and dad are here. His brother's here. His best friend's here. I'm sorry? Oh, Ryan's right there. He's in a wheelchair. Okay, so we'll get to that in a second. But anyway, so we had a patient we had a clinic in Costa Rica first, then moved to Panama. We had a patient in Costa Rica that had Becker's muscular dystrophy, and this was like 10 years ago. And Becker's is a milder form of muscular dystrophy than Duchenne's. In Duchenne's, there's a protein that's not expressed, and it's like less than 5% of normal in Duchenne's. With Becker's, it's around 50%. And so this guy came, so they don't, you know, the normal progression of Duchenne's is you're in a wheelchair by 10, 11, 12, maybe even younger, and then just things go south from there, and all your muscle fibers disappear, and you know, ultimately you wind up dying of heart failure, lung failure, or collapsing of everything. So this kid, with Becker's, it's milder, so it has a slower progression. So he was about 38 years old and came over, and he was, you know, walking like, you know, he's walking like this because basically all his musculature and centrally had gone away. And Dr. Solano, my medical director in Costa Rica, treated him with these umbilical cord cells, and the guy came back three months later, and he walked in completely upright into the clinic and said, "I want to see Dr. Solano." And that was the first time I even knew that Duchenne, or any kind of muscular dystrophy, could be treated by these cells. And so my first instinct, I wanted to call my buddy George. My buddy George is Ryan's dad, and we grew up like a couple blocks from each other. So anyway, we did talk, and then I wound up coming to Wichita, and we talked to George and Sandra and sort of all the stakeholders, and we were like, you know, if you guys want to do this, we'll do it. And as I recall, I may be wrong, but Sandra was a little bit hesitant about the whole donor thing because we're using umbilical cord stuff, and we had this menstrual thing, and so it was like, hey, what if we use, because I know their family, we grew up together, right? So my daughter Chloe is Ryan's age, my daughter Michaela is almost exactly Lauren's age, and so I said, maybe Lauren would donate some menstrual blood. As one says, you know. What you doing next month? And thankfully Lauren's not here, she's not going to hit me. But the point is that anyway, and so everybody was comfortable with that. So we said, hey, let's do that. And here at the Riordan Clinic, we took and made a starter culture of those cells. So I don't know, Ryan and Clint, they tell these stories of their friends that they're calling Lauren up and going, "Are you ready? Are you ready?" And she was at KState at the time, and so she's going to have to make the drive to make the deposit, if you know. And so anyway, she did. Eventually, you know, that time came, and she shot down here and did the donation. I won't get into the details on that, but she did. And actually, it's really interesting. There are these cups that they're called Diva cups, and this was something like way back I didn't even know it was a thing. Like it's not a tampon or a Tampax or something. It's like a cup that goes up in there, the cervical cup. Anybody heard of that? No. Okay. Anyway, so that's how we collected the sample. So anyway, so here, Xiaolong and his team grew these cells up from his sister, from Ryan's sister, and then there was frozen down in a little thing. Well, that's the starter culture. We need to grow them to a clinical dose in Costa Rica. So how do we get those down there? Well, Dad, George, just go ahead and put these in your suitcase and smuggle them in. So that's what happened. George is sweating bullets, and he came in there with these cells on dry ice in his suitcase, and then we took them to our lab, and we grew them up to a clinical dose, and we treated Ryan. And as I recall, Ryan's biggest problem, biggest complaint at the time was, and this was, when? Almost 10, just shy of 10 years ago. So Ryan's biggest complaint was that his neck was weak, and he has to go down a ramp, and he just couldn't hold his head up. So what autonomy he had was going to zero in a hurry. And so Dr. Solano injected cells basically in his neck and also IV. And then George reported to me like 2 months later, says, "Dude, I can push his head as hard as I can, and I can't push his head down." So, and he was making gains in muscle mass and everything. So that was the beginning of the Duchenne's thing. And now Blake, Lauren, and Ryan have a foundation that's coming together to a cure. And they had an event it was just a few weeks ago. I think I was in Iceland, but normally I come. And it was a record year, and they're just doing a fantastic job of all that. But anyway, so Ryan comes down, he gets treated, and this young lady, Tracy Thompson, was there, and it just happened. We were just talking the other day. So Tracy was there at the same time, just shy of 10 years ago, getting treated for MS, and she met Ryan and Clint, and they've been friends ever since. And anyway, Tracy now, I don't know, she's beautiful. She doesn't look like she has any MS. She's been treated a few times down there. She was in rough shape when she first got there. So they became fast friends. And unbeknownst to me, when I moved to Dallas 8.5 years ago, Tracy lives like a few miles from me. And so I was in the hospital getting my elbow operated on, and we have an orthopedic clinic in Dallas, and I'm like, Tracy? She like walked past, and I could hear this raucous laughing going on, and that's her family. They're nuts. They're crazy people. Anyway, so I'm like, is that Tracy? And she's like, Neil, what are you doing here? Okay. Anyway, so we reconnected like, I don't know, a few years ago, whenever I had my elbow. And her dad was getting surgery the same day by my partner, the same surgeon. Anyway, long story short. So anyway, Sandra, Ryan's mom, came the first treatment, it was Clint, right? Only you came down. You and George came down. Okay. They came down the first treatment. And then Sandra was not completely on board with the whole donor stuff. When she came down, saw other people getting it, I think her comfort level went up. And also we didn't have enough cells from the menstrual blood from Lauren to actually, in my mind, to give him as many cells as we could while he's down there. I mean, it's a big hassle. You got to get on a plane. You know, he's in a wheelchair. It's not fun. So what we did is we decided, all of us, to treat one half his body with umbilical cord cells and one half with his sister's cells. So it's an important point. Ultimately, it was blinded to Ryan. It was blinded to everybody. And it wasn't until Ryan had to self-report which side was stronger. And he said, I don't remember which side it was, but the right side or left side, and we unblinded it, and it was the umbilical cord side. So the point is that the menstrual MSC, they come from your bone marrow, which ultimately you have this store of MSCs in your body, and as you age, they decrease. And even at 20 years old, I think Lauren was 22, maybe 20. She was 20 when you started, yeah. So even at that point, they lose their kind of their ability to stimulate repair, decrease inflammation, and modulate the immune system. Those are the three main things that they do. So anyway, we progressed from that point to then Ryan was treated a multitude of times ex-US. We felt that the FDA should allow us to treat him here, and we filed for an IND for him to get treated here in the US. And thankfully, they granted that IND about 3.5 years ago, and he's been treated now for over 3 years right here in Wichita by Dr. Van Strickland. And we manufacture the cells elsewhere, ship them in here, and he's been getting his treatment. And what I'll tell you is that we were on a every 6-month treatment for him, and you could see that he would get a nice increase, and then about 4 or 5 months it would start decreasing. So we went back to FDA and said, hey, how about we treat him every 4 months? Because then, and now the last, I don't know, is it 3 or 2, 3 of them have been 4 months? And instead of going down, it's this. We're actually building. And we have a 6-year-old kid, now 7, who we're doing the same thing with in Indiana, and he's been treated. In fact, he started getting treated at 3.5, so our hope is that he never has to go into a wheelchair, that he doesn't lose enough muscle fiber to actually get to that point. So anyway, thank you, Ryan and family, for showing up. I really appreciate it. And Tracy and Clint And also for your pioneering spirit, because I know it's not easy being the first, right? And Ryan's the first on the planet, so it's not always easy, and it can be scary, but you did it, and really appreciate it. Okay, this is going to be a 6-hour talk. No, just kidding. I'm going to buzz through now. So this is Panama. You know, when I first heard of, somebody said, you should go to Panama. We were in Costa Rica. I'm like, Panama, that's like, I don't know, banana boats and stuff, right? Well, this is Panama today. So we gave the canal back in 1999, and it's, you know, our clinic actually in this picture is not even in this picture. It's just the building to the left here, and we're on the 63rd floor of a 65-story building. And it's just one of many. It's only the 4th tallest building. I live in the Trump Tower, which is over here on the 55th floor, and it's like 70 stories or something like that. So it's not, we're not in Kansas anymore, Dorothy. I was funny, I was showing somebody some pictures of the downtown Wichita. I was like, yeah, that building was the tallest building in the world, or in Kansas when I left, and it's still the tallest building in Kansas. 18 years later. So in 18 years, and this all happened from 1999 when we gave the canal back and they had the resources and everything. And so this is my happy place. This is our clinic, and that's looking out of the clinic. So Tony Robbins, thankfully, was kind enough to give me a blurb for my book. He's read the book, and he's a big fan. And he's on the cover of the book, there's a quotation from, and I think he says something about my book being riveting. Like, thanks, Tony. Did you read it? Anyway. So, you know, I actually met with somebody earlier, and they're saying, well, so you're doing it in Panama because they're embryonic. No, not embryonic, not fetal. Mom has a baby. Baby's with mom. Mom delivers the rest, or wherever, baby's happy, healthy. Mom delivers the rest of the stuff. That's what we take. We take that into the lab. We take the umbilical cord, and we process it. So if the baby's not healthy, it's not coming in. It's not even coming to the lab. So they're grown in the laboratory. We have a selection process, which is part of our deal. Is we select, because we have all the patient data, we can tell which cells are going to be good, which ones aren't. So they're completely tested for infectious disease. You know, endotoxin, basically anything that can go wrong, we can test for it, and that's the basis for our cells. And they're not controversial. You know, the Catholic Church has given many tens of millions of dollars to this research. The Southern Baptists have supported this research. We're not talking about anything ethically challenged here. So our laboratory is certified by the International Standards Organization. We founded this in 2017, so we have the Stem Cell Institute. Medistem Panama is the parent company. We currently treat between 80 and 100 humans a month right now. We have 6 doctors on staff. We have 62 other staff members that produce the cells, administer the cells. We're doing 7 clinical trials right now on MS, spinal cord, autism, rheumatoid arthritis, osteoarthritis, and asthma, and those are our clinical trials. We've completed our MS study. I'm not even going to put anything up here because it's in publication right now. We've completed our autism study. We've enrolled all the other studies, but we don't have all the data yet. We don't have all the data back on autism, but everybody's been treated, followed up, and then we have lab stuff that we're doing. So we have 2 compassionate use INDs that I told you about, which Ryan and this other kid, this 7-year-old. We just got funding from, I'll tell you about it in a second, but we're starting a spinal cord injury trial at University of Miami and Thomas Jefferson University in Philadelphia. The two busiest neurosurgeons on the Eastern Seaboard are doing this study, and they're using our cells from Panama, and we're doing the same thing. We're growing up clinical lots at Miami and then using them to treat spinal cord injury patients. So the 4 conditions I'm going to talk about. There are others that are applicable. If you think about inflammation, lack of repair, and autoimmunity or immune dysfunction, that's what the cells do. So Some people criticize and say, well, gosh, they can't be good for all that stuff. Well, gosh, they can. If that's the cause of all that stuff, of course they're good for that stuff, right? Anyway, so I'm only going to talk about these 4 indications because you probably want to go home tonight. So Bernie Marcus is the co-founder of Home Depot, and he's the one that just gave us a $10 million grant to do the study at spinal cord injury down in University of Miami. And he's actually a patient, and Bernie's in the book as well. And that's why I can talk about him, because he signed all the release forms. Believe me, he's got enough money to put me out of business. Anyway, Bernie came down for it's a problem in the lung, and it's caused by a certain bug. This bug you get from birds, and typically you treat it with 3 antibiotics for 2 years, and he couldn't take the antibiotics. And he was, I don't know, 84 at the time. And I just happen to know, I know his medical director for his foundation, and I know this crazy Russian dude that just treated people with, he treated people with umbilical cord MSCs for whatever. And so he published a paper years ago about treating this particular condition, drug-resistant this condition, with umbilical cord MSCs. And I'm like, my CEO of my old company was over there sitting with this professor, and I said, please ask him, he was on the phone, I said, please ask him what his rationale was for using these cells. And the guy goes, and it's interpreted back, and he said, well, whenever I have nothing else, I use MSCs. So that was it. And anyway, he took like 24 drug-resistant tuberculosis patients and made 21 of them non-drug resistant with a single IV of these cells. It turns out, I mean, just because it works and you don't know why doesn't mean it doesn't work, right? Is that a triple negative? Anyway, so it turns out now Stanford University, a few years ago, way after this guy was treating people with tuberculosis using umbilical cord stem cells, they found a molecule that's secreted by these cells called LL37. LL37 is the most potent antimicrobial known to man. Pound for pound, gram for gram, milligram, nanogram, picogram, this stuff works. And these cells secrete it naturally. So you get the cells IV, they go to the lungs, and guess what they do? They secrete something that kills the bacteria. Anyway, thank you, Bernie, for supporting our stuff. So this is kind of like just pictures of what we do. We take that umbilical cord, we cut it up, digest it, put it in the lab, grow them up. There's a lot of other steps, but that's the schematic of what we do. This is a picture of one of our clean rooms. We have 4. Now we have 4. When this slide was there, we had 3 clean rooms for manufacturing. Now we have a 4th one, and then we have in our clinic we have a syringe prep. So all the cells that come over frozen in the clinic, and we used to transport them across town, because our laboratory is actually at the City of Knowledge, which is our military base, U.S. military base. Clayton is what it's called. So we used to prep everything over there. Now we have a GMP laboratory built right in the middle of our clinic. And so we have lab people in there preparing everything right then and there, which is, it streamlined things a lot, and it allows us, we were stuck, we were at a maximum logistically of 60 patients a month. We built this new clinic, and now we can probably accommodate more like 200 or 300. And anyway, that's the deal. So we have a registry for everything that we treat, so we know, if things are going to go wrong, we know about it. For any particular condition, if they're not working, we know about it. I just kind of went over all this stuff. All our protocols are approved by it's a review board, national review board in Panama. Anyway, our license is from the Ministry of Health. It's the only license, to my knowledge, in the Western Hemisphere of a laboratory to produce cells for the treatment of human beings. So now I'm gonna skip right to a couple diseases. We're gonna burn through those and get you guys out of here. So this is a study. This isn't our study. It's 100. This is just they used umbilical cord MSCs, the same cells that we use. Here's the long and the short of it: is there were 0 side effects. Everybody got better. Who's heard of Humira? Who's heard of Enbrel? Who's heard of Remicade and Teracept? Okay. Well, those drugs are on your TV every night. Those drugs, they sop up most of them sop up a molecule called TNF-alpha. That's kind of like let's call it the big T. The big T is a real problem. It's a commander in the immune system, and it's basically causing this destruction. So if you have rheumatoid arthritis, then the big T is telling your white blood cells to keep attacking your joints. That's basically what it is. And so what these drugs do is they're antibodies. They basically block those things. So these drugs block, and you feel better. You feel better for a while until that whole thing disappears, and then you need another dose. You need another dose. Well, so the root cause of too much T, big T, is you don't have enough of another kind of immune regulatory cell. You don't have these regulatory cells telling the other white blood cells to quit making the big T. So your body just keeps making it. Well, guess what happens when you inject umbilical cord MSCs in the blood? Those regulatory cells go up. And guess what happens to the big T? Goes down. So they did a single dose treatment, 172 patients, randomized, placebo-controlled. The TNF-alpha dropped 50%. And this study went on for 8 months. So it wasn't every 2 weeks or every month. You had to have another shot of this drug. For 8 months, the TNF went down by 50% and stayed down. There's another molecule called IL-6. I'm not going to get into too many things, but another molecule similar, suppressed by 50% after one shot. So then, in a subcohort, they said, oh, let's do it again. So they treated another subcohort. At 3 months, guess what happened? Dropped even more. And this persisted. It dropped by another 25%. So you have a 75% total reduction, and everybody's better. And guess what the side effects? None. So I don't have a pointer. Maybe I do have a pointer, but here, it's just showing you the data, basically. And it's showing you that it persists. This is 6 months after treatment, and everything still persists. So we have patients. Our first rheumatoid arthritis patient was 10 years ago. 10 years. She hasn't been back. Her husband's a doctor. He's a good friend of mine. How's she doing? Fine. No problem. One of my business partners in another deal is his sister had rheumatoid arthritis for 10 years. She's on one of these anti-TNF drugs. Her husband, at 70 years old, was still working. He couldn't retire because he couldn't afford the drug. So she came down 3 years ago, and at the end of her treatment, she said, let's go walking at the mall. She hadn't done that in years. In the airport, she's like, let's walk around. So that was 3 years ago. She quit taking all of her medications. She was on a handful of oral medications as well as the IVs, and she quit everything. And that was 3 years ago. So her husband, he's like waiting for it to come back. He's waiting. I quit. So anyway, he retired. To me, it's great for her, but it's great for both of them, right? It's not just the person that's doing it. So I think that rheumatoid arthritis I'm going to talk a little bit about what's going on, why we're not doing this in the U.S. yet, later. But I can tell you that if I had those drugs I just described, it's $14 billion a year in revenues. Those drugs, $14 billion. I can tell you, if that was my $14 million bucks, I'm going to do everything I can to make people like me look like an asshole. So that happens all the time. But anyway, not politics yet. So type 2 diabetes, this is a big randomized controlled trial. These patients were followed for 36 months. Type 2 diabetes, they received essentially the equivalent of 60 million cells once, and then 4 weeks later, another 60 million cells. Guess what dose we use for most patients? And we don't even know these guys, never heard of them. And we've been doing this for years. We use 120 million cells. Because we know if you go over a certain dose, you're falling off the top end. So anyway, they were followed for 36 months. The hemoglobin A1C and after eating glucose levels were significantly improved. I'm not going to C-peptides, it's a molecule showing how much insulin your pancreas is producing, because you can't tell the difference in a lab test whether it's the insulin you're taking or whatever. So you take the C-peptide and you can tell. So here's the data. So the C-peptide, the higher one, that's the treated group. That's the control group below. They didn't have any increased effect, they went down. And everywhere there's a dot, that's where it's significant, statistically significant. And then you look at, this is a ratio. I won't bore you with the details. Long story short, hemoglobin A1C, you want it low. So the dark line is the patients, the subjects that received the drug, the umbilical cord MSCs. The white line is the placebo. And guess what? These patients aren't even diabetic. If you look at those hemoglobin A1Cs from about 12 months to 18 months, as a group, they're not even considered diabetic. So the long and the short of it is, type 2 diabetes is very complex disease, and there's insulin resistance, there's burnout in later stages. It's very complex, but I can say my conclusion is I think these cells are worth a shot in the long run. So a friend of mine texted me yesterday when we were packing up, getting ready to come up here, and he said, "Hey, do you guys do anything for autism?" That's like that's the number one thing we treat. So I sent him a link to, there's like a download for that chapter. And then he said, "Hey, you want to come? We'll go to we're going to deal with Martina McBride." I'm like, "Yeah, why not?" Tracy's like, "Martina McBride?" Anyway, we went to a fundraiser last night, and we talked a lot about autism at that deal. It was for Big Brothers and Big Sisters. So autism, in my mind, I'm just going to make a bold statement, which I make in the book, which is I think every chronic disease is either a lack of or a dysfunction of or a combination thereof of MSCs. And I've yet to find anything that counters that. And if somebody has something, I'd be willing to listen. So one of the things that people with autism have is they have an inflamed gut. The inflamed gut produces these molecules like TNF-alpha and IL-6 and things that go into the brain and freak out the white matter. The white matter actually swells, and then you have swelling in the brain, so then you don't have enough blood flow, so you got this whole vicious cycle going on. And MSCs, they calm all that down. And it's as simple as that. We wrote a paper many years ago. At last count, it had 74,000 downloads. How many scientific papers have 74,000 downloads? It's like nobody. Like, if we got 100 reprint requests back in the day, we were like, "Oh my gosh, that's so popular." Anyway, so there's this immune dysregulation, and there are these elevated markers in the blood that correlate with the severity of symptomology in autism. So our study is finished. Had 33 subjects, age 6 to 16. We recruited. They were all from the tri-state area in New York. Our principal investigator was NYU. He was in NYU at the time. Now he's with the Amen Center. Anyway, we treated 4 times 0, 3 months, 6 months, 9 months. So 3 months apart times 4. We measured all this stuff: childhood autism rating scale, the autism treatment quantitative scale. We did a quantitative EEG. We did look at these inflammatory markers. We have 31 inflammatory markers, and that's actually what we're waiting to come back before we publish the paper, because we don't have all the data on all the treated patients. But this was the worst. There were no severe adverse events. The only reported adverse event was pain at the site of injection. You ever got an IV? It hurts a little bit, right? So not as bad as Chris's mag sulfate in the butt, I can tell you that, but it does hurt. I almost didn't get this talk done because I was sitting around earlier talking with Donna and Carol, and I was telling my back's jacked from that whole being Superman in Iceland and not Superman, and from humping around that equipment, and they said, "Oh, you should get a magnesium shot." And so Chris gave me a magnesium shot. It's like, he's like, "Does it feel better?" I said, I can't feel it because this hurts so bad. But the magnesium calms you down. So then I haven't been sleeping well. I've been, just getting on time cycles all screwed up. So I go back to the hotel and pass out. I was going to do this talk, and I was like, okay, magnesium almost shut it down. But I got up in time. But thank you, Chris, for making my butt hurt. Where are you? There he is. Hey, by the way, Chris popped his cherry yesterday on speaking in public for the first time. Congratulations. And I heard you did a great job. They tell me they're still sweeping up the sweat, but good job. So anyway, this is one of these inflammatory molecules that's elevated in kids with, people with autism, in this case, these kids. And this is what happened after one treatment, after the second treatment. And this is the other inflammatory molecule, so these are significantly improved. This is looking at all the data at once. And the p-value on that, I mean, I can't remember the exact number, but I think it's around 28, and then you're not autistic anymore. Because everybody's a little bit autistic. I know I'm way out. I'm pretty close. Whatever that number is, I'm 27 if it's 28. But anyway, so 30%, 10 of these kids became, on this scale, were below, they're not, and by a neurologist, they're not evaluable as autistic anymore. And another 10 went from severe autism to mild moderate. The 13 did not move the scale. But given what the current state of affairs with autism, there's just not a lot there. So anyway, we'll get all the data and we'll publish that at some point. So spinal cord injury. This is a paper that was done in 2008, and I know spinal cord injury experts all over the world that never even heard of it, which surprises me. But they took human umbilical cord MSCs and they grew them up in the lab, and then they sliced the spinal cords open, and the spinal cord goes boink, and there's a little groove there, 1 to 2 millimeters, and they put human cells in there, and guess what happens? I'm missing a slide. That's when I was asleep. Anyway, there's a slide showing that you get restoration of function, and they re-sprout. So if you look at the spinal cord, I didn't get into the whole thing, like you have these cells throughout your body, and you have a whole bunch when you're young, and you have you have very few when you're old. Mel Gibson's dad was running on fumes, so it makes a big difference. Your spinal cord is running on fumes from the day you're born, because this tissue, these cells are only found around your blood vessels. And the fewer blood vessels you have, the fewer cells that are there to repair it. So God gave us this great cage around our brain and our spinal cord to prevent it from being injured. And if you were going to be injured from an evolutionary standpoint, if you're going to be injured, your spinal cord was going to be injured, you couldn't make it. You couldn't go shoot a rabbit or whatever you had to do to stay alive, or hunt, gather, you were done anyway. So why waste materials on it? So our spinal cord actually has just barely enough blood supply to keep it going. And so if you do anything to it, it doesn't have any MSCs to come off and repair it. So being from Kansas, duct tape and baling wire, you know what I mean? So I reckon the problem is you ain't got enough of them, let's just put some more in there. So they did that and demonstrated that's exactly what happens. So, and you've got these sprouting, this beautiful sprouting. It's like, our liver, if you could chop 80% of your liver out. Well, it's the most vascular organ in your body, right? It's just full of blood vessels everywhere. Guess what every blood vessel has? It has MSCs all over it. So you knock those MSCs off, you can cut 80% of your liver and it regrow, right? Your spinal cord, you can't even, you kind of like fart on it and it's done, right? So, no, I'm serious. Like a little bump. And that's actually what they do to stimulate spinal cord injury, or simulate. The animals, they drop a weight of a certain amount on a certain weight of a rat, and then they injure that, and then they can't move their legs, and they do all this stuff to try and get them back. But that's the problem. There's just not enough MSCs to fix it. So this is improvement 1 year post-treatment in a cohort of patients, and this are on self-care, different things. So roughly 70% of people got some improvement if you average all that out after one treatment. So typically, we don't just do one treatment. We do a multitude of treatments. So here's a young man that, I don't know how this works, Pablo or somebody, Mike. Can I play these videos? Maybe Paul can from the back room. Is the wizard there? Wizard? wizard. Sorry, Paul's across there. I'm just hanging. Anyway, so this young man was shot in the back, and some guy burst into a nightclub and just started firing indiscriminately, and he was shot in the back and lost everything from, I think, from T4 down. And, well, these videos showing him, his mom would videotape him every time he'd hit a new milestone. So the one on the left is him walking for the first time, and then the one on the right is him riding a bicycle for the first time. So Juan Carlos from Rio is kind of like a famous patient of ours because he was in Costa Rica, and we could treat him a lot when we were in Costa Rica and then subsequently in Panama. And JC, as he's compassionately known, he was at the time a commercial pilot. He crashed his personal plane, taking a National Geographic photographer around, smashed into the ground, and broke his back. And he had no function or sensation below the level of injury, so that's called an ASIA A. Most of us in the room, if you walked in here, you're probably an E. And after his treatments, he's a D. So he has some deficit, but you know, he got erectile function, he got urinary function, he got bladder function, bowel function, huge things. And that's what, you know, a lot of times we will try to set people's expectations, because if you get bladder function back, you know how big that is? If you can't control your bladder, it's big stuff. Anyway, in JC's case, he got everything back. And the neurologists, these surgeons, the neurosurgeons that are doing the study of spinal cord, we were trying to decide on where are we going to cut it off. And they're saying, well, let's just do 6 months, because we know after 6 months you aren't getting anything back. You got 99% of back after 6 months that you're going to get. So that's our starting point for our spinal cord trial. So he was 6 months and 3 days when we started. We published this paper in 2010, I think. So one of the big concerns people have is safety. You know, they hear these tumors are growing and all this kind of stuff. Well, the thing about umbilical cord cells is they don't form tumors. Never, ever. I'm going to show you some data later showing they actually have anti-tumor activity. So I always go back, what let me sleep at night in the early days, when you do something for the first time, you're like, wow, the possibilities are endless. And that's really scary. But what I knew then that I know now, and everybody else knows, is that moms get treated by their MSCs from their kids. When you have that baby, there's a lot of jostling going on. Those cells are running all over the place. And guess what? You can find them 50 years later in a mom. You know, every mother has kids from every baby she's ever carried. Every mother has cells in their bone marrow that you can find at any time from their kids. You know, there's a case in my book about a lady with hepatitis C, and she had carried a baby boy, and then her hepatitis symptomology was so low and her viral count was so low, they did a liver biopsy and found there was like 11% of her liver was now populated by her sons that she just carried MSCs. So that, you know, baby treats mom. Every younger sibling has stem cells from their mom and their older sibling. So if it's toxic, we wouldn't exist as a species. If genetically distinct MSC transfer from human to human were toxic, we wouldn't exist. No mammalian species would exist. So the other thing is that I'll show another slide in a minute, but there was a thought amongst the medical community that autoimmune disease actually went up in mothers, and that was since disproven in a big prospective trial. So this is really cool. The women live longer than men, and mothers live longer than non-mothers in a linear fashion, basically a third a year per kid. So think about that for a second. You have a kid, then you got to raise it, then it turns into a teenager, and you still live a third of a year longer, right? So this number is even higher now, but we've treated more than 5,000 human beings. We've given over 25,000 shots of these cells, and basically you're sitting there for the whole thing. You're in the chair for 20 minutes. Is it an event, Ryan? The IVs, are they an event? That's no big deal, right? I mean, Yeah, well, he gets special treatment. We like to beat him up, but most people, you just get IVs, and I have people that are all panicked and everything, and then they go, "Is that it? That's it? Now, what am I going to do for the rest of the day? Go to the pool?" Anyway, so Arnold Kaplan, who's the guy who gave these cells a name, the mesenchymal stem cell, he estimates more than 30,000 people globally have been treated and without a single serious adverse event. So, you know, when this is the menstrual MSC. In order to get FDA approval to do clinical trials with that, we had to show that it didn't promote existing tumors, because their concern was MSCs are involved in tumor microenvironment, this, that, and the other thing, but there's our umbilical cord cells and our menstrual cells have actually anti-tumor activity. So we had to do this clinical trial in order for them to release the cells. And so we did this trial, and this is a brain tumor, glioblastoma model. And this was actually done here at the Riordan Clinic. And we had these animals that were, it was done by researchers here. We don't have animals here. Protesters, go away. Anyway, these poor little rats were given a brain tumor, minding their business. And so we gave them cells either intravenously or one shot into the tumor, which is a trick, or 3 shots IV. And what happened was the tumor shrank by 50%. And that's the only treatment they received. So FDA said, okay, you can go ahead. That hypothesis is dead. So we went ahead and used the cells. So this was done at KState, right up the road. This doesn't get a lot of press, which I don't understand. I do understand from an economic standpoint. I don't understand from a humanitarian standpoint. But they gave, just read the title. Rat umbilical cord stem cells completely abolish rat mammary breast cancer with no evidence of metastasis or recurrence 100 days post-tumor inoculation. So they basically inject cells into the flank of these rats, and the tumor cells grow really fast, and then they go all throughout the body, particularly the lungs and the brain. And here's one that was treated just with the placebo on the left, and this is one that was treated with the cells on the right. And they mimicked our study exactly. They did either 1 shot into the tumor or 3 shots IV. And it didn't matter which way. This is the tumor volume. You can see the control animals, they had to sacrifice the animals because the IRB says if there's tumor volume so big, you got to sacrifice the animals. So it was just runaway growth, and it didn't matter which way you gave them. Ultimately, all the tumors disappeared, and there were no metastases. And they hypothesized that the MSCs actually got rid of somehow the cancer stem cells. So there are cancer stem cells that are, out of control. And anyway, so I've yet to find anything in the literature that doesn't support the fact that these cells have tremendous anti-tumor activity. And I would postulate that the majority of solid cancers are secondary to not having enough of these cells, because they control everything. They control the immune system, they control inflammation, and they control regeneration. So, when will this come to the U.S.? The biggest problem is the last few drugs that were approved cost $2.5 billion a piece. And we're just a little shy on that one. Anyway, thankfully we have a new commissioner who seems to be very interested in regenerative medicine and making a favorable pathway. Japan, which is a tier 1 country, passed a law that went into effect in 2015, which basically states once you demonstrate safety of your products. So our big problem here, our hurdle here, so Dr. Patel, who I work with at the University of Miami, he was here last week. We were meeting with the chancellor of Texas A&M. We were meeting with the governor of Texas about, I'll get to it, but we were talking about that. And we flew him in from Washington, where he was meeting with FDA. They had a 300-patient trial of heart failure where they demonstrated no safety problems whatsoever and 37% improved survival for a single intervention. They went to FDA and said, hey, what about this 21st Century Cures Act? Let's go. Let's get this to the public. Oh, no, you have to do a 600-person trial instead of whatever it was. You need to do another 600 patients at 20 centers so we make sure that it's not something. Well, that's going to be $200 million. So, and there's no money into it. Nobody owns that, right? It's just like crazy. If I as a patient want a treatment and my doctor's willing to give it to me and doesn't think it's going to hurt me, makes a lot of sense I should get the treatment, right? Anyway, so Japan passed this thing that once you show that your product is safe, you can use it in any way a medical doctor can use it to treat a patient, in any way they both see fit. The patient is fully informed. The doctor believes that this may help somebody that doesn't have any other things, and you have 7 years in which to demonstrate efficacy. I think something like that needs to be done in the U.S. in order for us to get over this multi-billion-dollar barrier for a drug. And I think the state of Texas might have solved it. We'll see what happens, but Tracy's here, and she has a foundation, Patients for Stem Cells, along with another patient, and other people have been treated with adult stem cells, and they tirelessly were supportive of this bill. It's called, is that here, House Bill 810? I'll get emotional if I start talking about this process, but I can tell you, we almost lost 5 times. And it takes a lot to get a bill through the legislature in Texas, particularly this session. They only meet every 2 years. They only meet for 5 months. Everybody wants to kill everybody. And thankfully, we had some really good leaders that were calm, and they got this through. I mean, we had 5 points of failure that were just within a fraction, a hair of going wrong, and we wouldn't have this bill. We tried in 2015, and we didn't get out of committee. This bill passed the House. It looks great on paper because it passed the House and Senate unanimously, which no other bill did. So it looks like, oh my God, slam dunk. Oh no, it was late nights, and it was phone calls. It was calling in the cavalry at all times of day and night. Anyway, and the governor signed it shortly thereafter, and it went into effect September 1st. So it looks like, hallelujah, thank you. So John Sharp is the chancellor of Texas A&M. Oh, this is on the internet, is it? I don't care. He's the chancellor of Texas A&M. They have a new biotechnology thing. And this guy's a real forward thinker. He's a no-nonsense. He curses, he chews. He admits to all that. But we had a meeting with him on Saturday. We were his guests at the Texas A&M game, playing in South Carolina. And they showed us around their technology park. They want us to go in there and put one of our manufacturing facilities there and work with them in the medical school and all that kind of stuff. And he said, why don't we have this effing shit done? Literally. That was his conclusion, right? He says, this is ridiculous. I don't get it. And so, thankfully, in the environment in Texas right now is we're fed up with federal government telling us what the heck to do and what not to do, and bureaucrats that don't even know anything about the science telling us what to do and not to do. And so I think it's a fever pitch right now. And if you told me 10 years ago we're going to be here in 10 years, I wouldn't have believed it. I wouldn't have believed the miracles that happened, the 5 miracles that had to happen for us to get this bill passed and then signed by the governor. That's the 6th miracle. Anyway, the good news is this bill is now law in Texas. There are a few things that have to be done, but it basically it's a provision of investigation. This is out of the bill itself. Stem cell treatments to patients with severe chronic conditions or terminal illnesses. So the key there is what is going to be included in that list. So our job is not done lobbying, because our job is to lobby to say, hey, we believe the doctor should decide what is a serious debilitating condition, not some bureaucrat. So that's what we're lobbying for right now. But anyway, so this is the process. The doctor has to agree. The patient has to agree. Doctor writes a prescription. Patient gives informed consent, and away you go. So that's about it. I mean, MSCs, they're the reason you repair yourself, right? And when you're young, you got a boatload of them, and as you age, it gets depressingly worse. So I didn't talk about them acting as localized drug stores, but that's what they do. They react to the environment, and they respond back appropriately. So if you have too much inflammation where they are, they're going to put anti-inflammatory stuff. You're not stimulating enough immune response, or a bad immune response, they'll correct it. Anyway, they're safe, non-tumorigenic. They're universal donor cells. You don't need, you can go from any human to any human. There's never been an immune reaction. They have significant anti-tumor activity. I think they're the new revolution in medicine. And whoever, if you got the book, I hope you enjoy it. It covers all this crap that I just said. That's the main reason I wrote it, is so that people could hear my story without having to listen to my voice going on. Anyway, thank you guys very much. Really appreciate it.